We'll now move on to our sixth presentation for today. Welcome to Ian Montague from National Disability Services. So Ian, if you wouldn't mind stating your name and your organisation for the purpose of the record, and then we'll move on to your presentation.
So my name is Ian Montague. I'm the State Manager in Queensland for National Disability Services.
Thank you. Over to you. Thanks, Ian.
Thank you. First off, I'd like to acknowledge the traditional custodians of the land on which we're meeting today and pay respects to the elders past, present and emerging. I'd also like to express my appreciation for being able to work and live on country. I'd also like to acknowledge the Queensland Government for actually tasking this inquiry. I think this is a perfect time to actually review and see where we're at, given that the state is now fully rolled in. And I think having an inquiry at such a critical time is actually fantastic to get an analysis of where we are and where we're up to. I'd also like to acknowledge the work of the QPC and Karen as Commissioner, you in particular, but also your broader team. A 600-page report across the full range of things gives an idea of just the complexity of the NDIS, and there are so many issues, and to get on top of that in such a short amount of time is extremely impressive. Even in today's conversation from people presenting today, we've heard about allied health, independent assessment, restricted practices, the NDIS Quality and Safeguarding Commission, employment, planning processes, justice and child safety, and that's not the full list, but it does show just how complex this is. And I'd also like to thank the Commission for providing NDS the opportunity to engage so strongly in this process. We have run round tables with you, which we're looking to do again, and we are thankful for the opportunity to make submissions as we've gone along. I'd also like to acknowledge that many people, groups, individuals, organisations that have also made representations to the inquiry, and I think that's added to the breadth and depth of the understanding. The disability sector fought hard for the introduction of the NDIS and believes in the findings of the Australian Productivity Commission in their inquiry, Disability Care and Support, which was delivered to Government on the 31st of July 2011, almost 10 years ago. NDS as a peak body has been a major contributor to that action, predominantly through the Every Australian Counts, and we remain today still 100% behind the concept of the NDIS. Providers, both individually and as an entire sector, have not only invested financially to make the NDIS happen, but often physically, emotionally, and definitely spiritually as well. Today, given we can't talk about everything in your report, I'm going to focus on three main areas and really focus on three main stakeholder groups. Some observations around providers see for individuals approaching or within the NDIS, for service providers as a key stakeholder to the system, and the need for a diverse, resilient and well-supported workforce. I'm limiting myself to these due to the available time because we could spend hours and days and weeks talking about these things. I think, as has already been mentioned today, the NDS is there to enable people, and we absolutely believe in that basic principle. I will leave others to talk about those individual issues, and we've already seen presentations today and more coming, but I would like to make some observations from a provider's point of view. True choice and control requires informed decision making, and that will only, when that occurs, the scheme is most likely to be optimised. Building consumer ability is a key success factor in the scheme. Consumers need to better understand their risks, be able to observe and understand and receive value for money, and ideally also understand sustainability of the system. NDS acknowledges that such skills will not be achieved evenly across all participants, but it is a worthy activity. The scheme is complex, as noted in your report, and relies too heavily on NDS navigational and language skills. Who is responsible for what and when is not clear, and that makes it very difficult for consumers. A key factor in the consumer process is very much around the development of a good plan. Good plans, when they are arrived, make all the difference, and good planning ensures good outcomes. We as a peak body acknowledge that planning is difficult, but we don't want to see things like the person's socio-economic situation, their cultural background or the geographic location as being acceptable reasons for differences in the planning process. In the NDIA's own figures, you can see the variation between states, between disability types, and between types of activities in service delivery. As providers, we observe the confusion about who is funding support and what is not an issue for who is funding support, and this is not an issue for individual participants. The systems within the NDIS and its interaction with other mainstream services, like health and education, to just mention a few, need to be better understood, need to be more transparent, and the practices need to be more homogeneous. These interfaces are government-owned. They are complicated and they are often multi-jurisdictional. Governments and the agencies need to do more, as such issues cannot be resolved by the individuals or individual service providers alone. The current Disability Royal Commission, I think, will actually help highlight on many of these concerns and issues, and it'll be up to all of us, including government, providers and individuals, to make sure we maximise the opportunity that the inquiry presents. From this perspective, we agree with the observations in your draft report of 1 to 4, and we have in principle support for draft recommendations 1 to 5. I'd like to go on. There is no NDIS without service provision. The sector wants the NDIS to work, and the sector has a major stakeholder in this scheme. As a peak body, we want services to be quality and to be delivered by sustainable providers. The NDIS market, both supply and demand, is not maturing consistently, and is impacted by geographic location, service type, and the interaction with other mainstream services. The transition to the NDIS has been extremely difficult for service providers. In a presentation I listened to in Victoria in 2017, a provider who had recently gone through transition made the comment, which I think has held true: no service provider enters the NDIS and comes out the same. And having watched the rollout and been involved in the rollout in Queensland, I think that's absolutely the case. The NDIS has created new roles and new business opportunities, and this is resulting in a diversity of service provider structures and services and offerings. For this reason, we agree with the draft findings of 5 to 11, which look to address the gaps, build and share data, and purposely increase the use of technology to support market activity. How this will be done will be the detail, obviously. We'd also like to support the draft recommendation 12 for the standardisation of quality schemes across the various quality systems. However, we do feel this is a very ambitious recommendation. With regard to the provider's guarantee, recommendation 15, we are in total agreement. Providers are a major and critical stakeholder to the NDIS, and it's been disappointing to date just how far providers have been kept out of the engagement. NDIS and individual organisations spend significant energy representing their views in issues that could have been foreseen had conversations been held. Providers are often dismissed because they have a conflict of interest. I suggest that all parties, individuals, advocates and all levels of government, and the NDIA itself, as noted in your report, have a conflict of interest in the delivery of the NDIS. NDIS is responding to numerous actions with parties connected to the NDIS. To give an example, nationally since July last year, we have prepared over a dozen formal submissions to various groups on a diverse range of topics, all impacting the NDIS. This does not include state submissions or the numerous consultations that are required to prepare those submissions or the background work that's needed to inform critical thinking. There are many things to fix and providers' input is critical, yet providers are having to deal with their core business in a new business models and new structures. This is proving difficult within the sector. The sector needs government and agencies to support it, listen to it, while also recognising their time is limited. I'd also like to say that there is no service provision without a diverse, resilient and well-supported workforce. Disability service is delivered by humans for humans, and price absolutely impacts the salary of the workforce and the career opportunities that the sector can provide. Career opportunities are defined by the price. The ability of supervisors to ensure staff are trained and receive appropriate professional support is impacted by their span of control, and this too is defined by the price. Access and management of training is defined by the price. It is not just the cost of training itself, but the backfilling and releasing of staff, the management and coordination of training activities. For good training for good professional development to occur, it requires good training, it provides organisational and professional support internally, and it requires the opportunity to have training undertaken. The concept that is often referred to that training is a business decision and is not the responsibility of this scheme is a major risk in terms of quality service provision. Whether it is the responsibility of the NDIA or other government departments is irrelevant. Collectively, we need to work through it. Fortunately, there is work being undertaken at the moment, but this has been long coming and long in process, so things like national workforce plans, capability frameworks have been slow to be implemented. As I mentioned, we need a disability workforce that is diverse. And with that, we need training and professional development opportunities that also need to be diverse. We need to have opportunities that meet cultural backgrounds, that can deal with in-house training, sector training, micro-credentialing, accredited skill sets, and indeed full qualifications. Each of these have their own pros and cons. There is no single solution. Again, a recognition that the sector is diverse. Traineeships are often cited as the answer, and personally I know that's not the case. And the use of allied health assistance as the solution, as we've heard a little bit today, earlier this morning, is a solution, but it's not the solution. Such roles, traineeships and assistants, work in some contexts and in some settings, but not all. As I mentioned, training is often limited by the availability of time for supervisors to actually coordinate the activity of training itself. Government, both Commonwealth and state, need to continue the work that they are doing and actually engage more to support the sector to build and maintain a diverse, resilient and well-supported workforce. Sector-wide approaches like capability frameworks, access to learning resources, access to peer support are all things that cannot be resourced within individual providers. I would like to acknowledge at this point that NDS, and particularly the Queensland Division, has been fortunate beneficiary of government support over a long period. Because of the Queensland Government funding, we've been able to provide many capacity and capability improvement services to the sector over a significant amount of time. I appreciate that support. However, I must admit that the annual contracting, which without security of continuation, makes it hard to focus on long-term responses that often take time to build. So in closing, the sector continues to support the principles of the NDIS and is behind its implementation. Providers want to be a quality and sustainable partner in the delivery of the NDIS, and providers recognise that a diverse, strong and resilient workforce is a key factor in doing that. Again, I'd like to thank you and the Commission for providing the opportunity to talk today. Thank you.
Thanks very much, Ian. In your oral submission, you talked about the criticality of prices, not just in terms of service delivery, but quality of service delivery. I'd be really interested in your views on our recommendations around price deregulation.
It depends. So again, I think there are two things within the price. One of the keys, or two factors really, is whether the market is ready for it, and that depends on consumers. Do consumers have enough knowledge and skills and ability to actually make those decisions well, that it's not just a price mechanism and let's go for the lowest? And also the sector itself, is it able to deal with such a change? It has gone through an ordinary amount of change already and does so on an annual basis with price reviews. In some ways, the deregulation is occurring in the non-registered provision sector, which is a significantly growing part of the system. But it does concern me that in that sort of process, the impact on quality, accountability, as mentioned previously today, are all issues that I don't think the market's really got right yet. And as I mentioned, maturity in the market is not consistent across all services. So there are certain areas, and particularly new roles, that we are still finding out what good quality service looks like, and that's been mentioned today.
Thanks, Ian. So one theme in our report which you touched on is complexity of the regulatory framework. Be really interested in your insights into how the complexity of the regulatory framework is affecting your members, particularly given we are seeing that trend towards unregistered providers.
So Queensland as a state had quite a strong quality system in place. So in comparison to other jurisdictions, we are probably getting through our audits and compliance things better than some. However, there is the cost that's been mentioned today, and in many ways that becomes a part of a business decision. As you've heard with the allied health speakers this morning, a lot of those providers, the fact that the NDIS is not their only business opportunity, they'll make a business choice, what they need to do. It is complicated, the rules are changing all the time, and there is immaturity again in the market around this. So we now have auditors who are approved by the Commission to deliver auditors, who are going out doing audits and coming up with different responses and interpretations of standards. That will improve over time, but that does cause a lot of grief to individuals within organisations who are trying to manage the process and organisations trying to get through. So again, it's an immature market with an immature quality process in place, and so it's quite costly at the moment.
We heard today also comments around the Quality and Safeguards Commission and a view that their role needs to be strengthened and made more effective. What's the provider perspective on the way the Quality and Safeguards Commission currently operates?
It's probably more than I'd be willing to sort of talk about here today. I think a lot of this will be coming out through the Royal Commission and has been coming out after some of the incidences that have happened nationally. Again, at the moment, I suspect it's very reactionary. There are a lot of people trying to do a lot of really good work and put systems in place, but it's an immature process, and unfortunately some things are slipping through.
You gave support for the provider guarantee, which is one of the draft recommendations in the report. Where do you see the provider guarantee having the greatest benefit, and what would NDS like to see within that provider guarantee? It's an area that we've asked for more information about, where it would be of most benefit for providers in particular.
I think establishing that sort of benchmark that the sector is a key stakeholder in this and does need to be heard is important. I think how it's implemented obviously will be the most critical thing. If it's a tick box arrangement, well, we consulted with you and we've done our bit. And there are easy KPIs which you might say, well, yes, it's a tick box. If I use an example, the call centre, the agency is monitoring and managing how quickly calls are answered. While that is a KPI, it doesn't necessarily mean that the call has been answered well or is actually given good information. So I think there needs to be some thought around how that might happen. Just the ability to hold up and say, hang on a sec, we have a right to say under your own charter would actually be a strong benefit, I feel.
You mentioned earlier in your comments that you can't divorce choice and control from informed decision making. And in the draft report, we've obviously got a number of recommendations around seeking to increase the level and quality of information available to NDIS participants to support decision making. Do you think we've got those recommendations right? Do you have any other suggestions on how we might enable participants to exercise choice and control through more provision of information?
I think you have. I don't think it's all going to occur at once, and I think there will be pockets of it as well. So certainly people who've been fortunate to have advocates with them or have very supportive and informed support mechanisms around it absolutely do better. There's no doubt about that. I think this is a continuous process and it just requires everybody to keep sharing information. I personally think there's a lot of data in the scheme that is being collected that is not open for interrogation, and I think that's disappointing. There is a lot of patterns that potentially people could be picking up if the data was made more accessible or just openly given out for interrogation. Not wanting to acknowledge that there are privacy issues around some of that. But I personally believe there are ways to do that data so that individuals can't be identified within it. So I think there's a lot of work and we can do a lot more around identifying the gaps and understanding situations.
Ian, you spoke earlier also about the need for sustainable providers. As it's currently constructed, do you see that the NDIS market is sustainable in its current form?
So we do an annual market survey and we ask providers to give their perception of what's occurring, what's happening. And this, in 2020, was probably the most positive survey that we've done, where providers, about 2/3 of providers said that they were either going to break even or make a margin. And that's great. Although 1/3 of providers are saying that they're not going to make a margin, and that's of concern to us. That's not to say every provider has to be sustainable. This is not a charity in itself, so I think there is still work to be done. I think because of the complexities of the scheme, it's in pockets. So for instance, there's a lot of work going on at the moment around SIL and effectively trying to bring down the costs within the SIL process. That hasn't worked its way through. There are similar things around employment, around group activities. All of these are changing the pricing mechanisms, and we haven't seen yet the flow and effects that will do in the marketplace. I know for group provision of group services in Victoria, there are some providers having shut down for COVID, have made the conscious decision that they will not re-enter the market because people aren't expecting their service to be there. That's disappointing that people are having to make those sorts of decisions. So there's not a standard response to that because it depends on the type of service being delivered. There's just so much activity happening at the moment. There is general concern within the sector around the independent assessment and whether this is a way of driving down the cost of plans and cutting back on activity. Time will tell.
You also mentioned the importance of the planning process. It's sort of fundamental to the scheme. and generating outcomes for participants. From the provider perspective, any insights into whether or how the planning process could be improved?
I think the principle of the NDIS, which says every person is an individual and they come with their own circumstances. So, for instance, if you're an autistic child, or as was demonstrated today, if you have an intellectual disability and the parent also has a disability, then that situation and context is different. And unfortunately, I think what we're seeing too often is that context is not being picked up. The diagnosis or the recommendation is just based on a standardised plan, and too much is requiring on people to then advocate or have advocates for them identify, well, these are all the complexities and the difficulty, be they in the justice system or in childcare, child safety, etc. The planning process should bring all of those things together, and it concerns us when these are done quickly. I personally would hate to have to do it to try and understand all the intricacies of all the different forms of disability. Is a big ask in anyone's mind, but that's what the scheme is about, and the scheme has to cope with that. When it works, as I said, and it often works when there are strong advocates or there are for the individual who have done their homework, know their rights, know what they should be asking for and have prepared, the planning process works. It's very worrying when planning processes completely miss things, like incontinence pads or behavioural support plans, when it's clearly that they would need it. And the amount of rework that requires to get fixed and the time delay is very disappointing.
So you touched on workforce issues and the importance of quality workforce to provide quality services. And we have a number of recommendations aimed at trying to address the issues around workforce. Where do you see the role of government in that space versus the sector itself?
That's a good question. I think governments within the scheme, as I said, no individual organisation can really cope with workforce development. There is not the mechanisms within the pricing arrangements to actually deal with that. Even the very large organisations with 400 or 500 staff often work in part-time arrangements, so there might be 5,000 FTEs and 10,000 individuals. It's really difficult to schedule and do quality training under the pricing mechanisms. So I think governments have got a real role and opportunity to provide the necessary supports and mechanisms to make these things happen. I'll give you an example. The Quality and Safeguarding Commission, to their credit, commissioned the induction module, said this is a mandatory thing, but they paid for the development of it. They didn't say to providers, well, we expect all of you to work out how to do this and we'll check you later on. And I think those type of resources that can be done holistically and across boundaries is the way to go, and providers then can pick it up and start using it. NDS, for instance, has developed a suite of material around zero tolerance, which we have made free to anyone to use in any way they can. That's a way of empowering the sector to not have to start from scratch, but to actually leverage off the learnings of the sector. So we'd like to see more of those things encouraged, more peer networks, greater emphasis and control, greater emphasis for systemised approaches and responses.
So our report touches on the very important issue of thin markets in Queensland. I just would be interested in the NDS view on whether over time that will correct, or whether you feel an intervention is needed to ensure service delivery into particularly some of the more challenging regional remote communities.
So keeping in mind thin markets is not just geographic, so it may be particular types of services, and the OTs, the allied health, you could probably argue is a thin market. Again, it's not a simple answer to that. But if I go to your regional and remote, and where they also have cultural need cultural responses as well. I personally don't believe that the current systems and practices will ever generate a market in those locations. If it was just market driven, then there would be a lot of systems in all of those locations already, be they education, health, legal, all those sorts of things. So I don't think the disability is unique in that. The agency is saying it's doing a lot of pilots and things, but it's not easy to see where they are, or it's not easy to see the learnings of those pilot programs. With my colleagues nationally, we're looking for those and to see how we can learn and leverage and see what opportunities are. But I think the agency at the end of the day is going to have to go in with a different model than just free market. It's not going to fix the issue.
Look, thanks very much, Ian, for your oral submission today and covering off a very broad range of issues. And you're right, we could speak all afternoon on the scheme, given it is such a large scheme and so complex. So thank you for your participation.
And thank you for the opportunity.
And again, for the support that you have given the inquiry through the roundtables, the meetings that we've held and the submissions. We do appreciate it.
Thank you.
Mm-hmm. So we might take a short break before we turn to our 7th presentation.